A number of recently reported studies have evaluated various antiretroviral approaches in pediatric patients. What do these findings suggest for the future treatment of HIV-positive children?
Children are not always small adults. They have special metabolic demands and special profiles of side effects. So it's vital that we evaluate antiretroviral drugs in children to ensure that those recommendations being made for adults are or are not appropriate for children. We certainly have insights from recent studies that, for example, children do somewhat better on the NNRTI efavirenz than they do on nevirapine as a therapeutic agent. That's an important insight because in the past, particularly in low resource settings like Africa, nevirapine was very dominantly being used and was cheaper. So knowing that efavirenz has some competitive advantage gives us a lot of incentive to work with the drug manufacturers and try to lower the cost of efavirenz, make it more available. We also have, I think, a need for many more pediatric friendly dosing regimens. For example, liquid medications, smaller pills that can be crushed and put in food. There's a dearth of such available products, and that severely limits our ability to optimize therapy for infants and children. Happily, I think there is greater consciousness about this, and certainly NIH initiatives such as the IMPACT network are working assiduously to try to address some of these issues. We would be pleased if we saw greater interest on the part of the pharmaceutical industry to help us with these drug optimization challenges.